Caritas Damayan, daig ng maagap ang sakit at sakuna. Caritas Damayan is the umbrella program of Caritas Manila that covers disaster risk reduction, relief and rehabilitation, crisis assistance, preventive health, nutrition, and plant-based food security program. The main beneficiaries of Caritas Damayan are the poorest families, vulnerable groups like street dwellers, elderly, handicapped, inmates, stranded students and seafarers, construction workers, jeepney drivers, and OFWs, medical, church, and government frontliners, poor dioceses, and individuals in crisis. Under Caritas Damayan are the following programs: Disaster Risk Reduction and Management Program, All is Well Preventive and Promotive Health Program, Caritas in Action Crisis Assistance Program, Caritas Contra COVID-19, Munting Pag-asa, and Unang Yakap Feeding Programs, and the Gen 129 Plant-Based Food Security Program. Caritas Damayan responds to all disasters and calamities, whether natural or man-made, using the network of dioceses, parishes, schools, organizations, and social action centers and partners. Caritas Damayan's organized network of community leaders, parish priests, and volunteers respond to disasters within 24 to 72 hours. This is the most critical period for those affected by calamities. Caritas Damayan keeps in stock enough emergency food and items year-round to respond immediately for up to 20,000 affected families. The Caritas Damayan Emergency Relief Packs are Caritas Mana Food Pack, Caritas Emergency Food Bag, Caritas Hygiene Pack, Caritas Go Bag, Bedding Materials, Shelter Repair Kits, and Caritas Wash Kits. For recovery and rehabilitation, Caritas Damayan DRRM extends livelihood, fishing, and farming assistance, shelter repair, and church reconstruction. When needed, Caritas Damayan helps construct 3-in-1 multi-purpose chapels all over the country. 3-in-1 chapels serve as place of worship, evacuation center, and community multi-purpose venue. The All is Well Preventive and Promotive Health Program. There are 28 Caritas Manila Health and Wellness Centers in Mega Manila. These Caritas clinics serve around 20,000 patients yearly. These clinics provide free medical consultation, free medicines, and free laboratory or diagnostic tests. Each urban poor partner family is also provided with a health handbook entitled Gabay at Lunas sa mga karaniwang karamdaman. The Caritas Munting Pag-asa Nutrition Program aims to alleviate extreme hunger and malnutrition and improve the overall health of poor, malnourished children aged 6 months to 12 years old. These children undergo supplemental feeding for 120 days and given vitamins, hygiene kits, and food keepers. Both children and parents also undergo health and nutrition education. Meanwhile, the Unang Yakap Nutrition Program aims to alleviate extreme hunger and malnutrition and improve the overall health of pregnant and lactating women. These mothers are also enrolled for 120 days of supplemental feeding. They are also provided prenatal package and mother's classes. Munting Pag-asa and Unang Yakap focus on the first 1,000 days from pregnancy to the child's first 2 years. This is the window that helps prevent long-term effects of malnutrition. The Caritas in Action Crisis Assistance Program. Caritas Damayan, in partnership with Radio Veritas 846 through the live radio and online program entitled Caritas in Action, implement the Crisis Intervention and Assistance Program of Caritas Manila. Through Caritas in Action, individuals and families in crisis, particularly the poor and the sick, are able to appeal for help and assistance from donors and Good Samaritans. Caritas in Action airs every Monday to Friday from 1 p.m. to 2 p.m. It serves as a platform for beneficiaries to ask for help and explain their situation while trying to reawaken the Good Samaritan in everyone. Caritas in Action provides the following assistance: hospital bills, medicine, medical equipment and supplies, laboratory assistance, crisis food bags or Caritas food packs, funeral assistance, blood requests, and referrals for psychosocial and legal services. Caritas in Action serves around 10,000 crisis cases every year. Caritas Contra COVID-19. At the onset of COVID-19 in the country, Caritas Manila launched Caritas Contra COVID-19, providing Caritas food packs, contra-COVID protection and sanitation kits, and implementing feeding programs in poor communities. With funding from the business community to fight hunger, Caritas Contra COVID-19 carried out the door-to-door distribution of food vouchers in the form of gift checks redeemable from the most accessible grocery chains in Mega Manila and nearby provinces. This was the most massive aid distribution in the history of Caritas Manila. Caritas Contra COVID-19 helped distribute over 2 billion pesos worth of food vouchers and assistance. Caritas Contra COVID-19 now serves as basis for future pandemic response from Caritas Manila. Last is the Gen 129 Plant-Based Food Security Program. Gen 129 is Caritas Manila's plant-based food security program under Caritas Damayan. The name is taken from Genesis chapter 1 verse 29. Then God said, I give you every seed-bearing plant on the face of the whole earth, and every tree that has fruit with seed in it. They will be yours for food. Gen 129's main thrusts are addressing food security, curbing poverty, intensifying environmental advocacy, ensuring physical wellness through plant-based diet, and caring for God's creation. Gen 129 encourages parishes and Caritas partner communities to convert their vacant spaces for vegetable gardening for local food production. Gen 129 intensely advocates lifestyle change through plant-based diet and nutrition. Caritas Manila strongly believes that plant-based diet is the healthiest and most effective diet to fight chronic diseases like cancers, diabetes, and heart diseases while reinforcing longevity and wellness. The plant-based diet movement is also one of the means to fight climate change by helping reduce animal-based food production.